Hi, I'm Dr. Melissa Blake, and recently I was asked what the impact of isolation might be on our immune response. So typically, we're exposed to a pretty wide variety of people and their bugs, right? So whether it's through our work environment or our children going to school, or just running errands, we're exposed to a lot of people on a pretty regular basis. So, the question is that if we're limiting our exposure to other people, could that actually impair our immune response for when we return to whatever a new normal might be? And this question was raised because the person that asked it had noticed when she returned to work after maternity leave that she seemed to get a lot of infections. Part of this was because her children were attending daycare and their exposure was higher and they were bringing things home. But also, she wondered if maybe that year away from a lot of people, a lot of different people, maybe impacted her immune system. And so there's a couple of things that I want to mention about this. The first is that we are constantly exposed to many potential threats. The food that we eat, water, dust, pollen, there's microbes everywhere in the soil, from pet contact, and even from minimal human exposure. So all of that is happening whether we're in contact with a wide variety of people or not. And that means that the immune system is always working. You don't have to be sick in order for your immune system to actually be active and functioning. And not being exposed to people, and therefore the bugs that come with that interaction, it doesn't mean that our immune systems are taking a holiday. It does mean that you might have less exposure to some of the bugs that are kind of circulating during that season, so that when you do enter the workforce or your children go back to school, you're probably going to be naive to some of those bugs that are circulating and might have a period of illness because of that. But, and I'm going to say this, and I know that not everyone is going to be happy to hear this, that getting sick is actually a really good thing. Now, I want to remove the virus that causes COVID-19 from that statement, because any new, novel virus, particularly one that's as, let's say, potent as COVID-19, doesn't really fall into the same category, right? What I'm talking about are the kind of common low-grade infections like the common cold or, a regular seasonal flu. For most people, getting sick once or twice a year is actually really helpful to your immune system. It builds resilience and it helps the immune system know what it should do. It's like training for the immune system. So every time you get sick and support your body and you heal, you actually strengthen your immune system and it learns something new every time, so that the next time you come in contact with a similar virus or that particular strain of virus, you're more likely to fight it off without even having any symptoms. So it's important to consider that the immune response or immune health is a spectrum. On one end is a low functioning immune system, and we don't want to hang out there. A low functioning or a hypo responsive immune system means that you're sick all the time, or when you do get sick, all the symptoms linger. Like you get a cold in the fall, and even in January you're still fighting a lung infection or a sinus infection, right? We don't want to hang out there. If we do get sick, we want to resolve it. We want to have an adequate response so that 10, 14 days, we're feeling a lot better and the symptoms are almost completely gone, if not completely resolved. The other end of the spectrum, though, is a hyper or an over responsive immune system. And this is when the immune system, as I mentioned, kind of forgets or loses the ability to distinguish between self and non-self, or is over responding to things that are not actually harmful to our health. So those are things like allergies or autoimmune disease. So we don't want to hang out in that end of the spectrum either. We really want, the ideal situation is to be somewhere in the middle. So, what isolation does offer is an opportunity to really take care of yourself as much as you possibly can and to use power habits that support immune health and overall wellness so that when we do return to whatever our new normal will look like, our immune systems are more likely to be able to respond appropriately no matter which virus we come in contact with. I hope that was helpful, and I look forward to our next conversation. One clarifying point I wanted to make is that isolation in the context of the current social distancing requirements that are in place is not the same as loneliness. Loneliness is something that someone can feel regardless of whether they're isolated or not. And strong feelings of loneliness have been associated with higher levels of inflammatory markers and higher cortisol levels, which is one of our main stress hormones. And these factors definitely can have a negative impact on immune response.